Hello, Joe.
Hiya.
Hello, you're quite numb after the whole this procedure. Today we have fitted the final restorations, the crowns, yes, implant, crown as well. And I just wanted to ask Joe, how are the symptoms in comparison to when we started? Have they changed? Have they kind of deteriorated? Are they stable? Just overall general health after having, the tongue space enhanced during an aesthetic rehabilitation. So how are you feeling?
Well, prompt me about things, but when I came, I was having a lot of hip pain and
is that still okay? Like has
that is all gone.
Wonderful.
But there was a moment a while ago where I was getting some twinges back, and my jaw started to click again. And that's when we did those.
Yes,
but I'm jumping ahead a little bit.
No, that's very important because we started to for the symptoms to creep back in, and basically we've added a little bit of composite on the teeth because it did wear. Things do change. That's why that 3-month temporization, observation, how the muscles are adjusting to, and the whole body actually to the new bite. And if we see a reverse of symptoms, it may mean that we need to add a little bit more, and we did use special templates for that to copy that phonetic registration, and we have been repeating it along the way because while the muscles are letting go, all those spasms are letting go, things change a little bit, and that's why.
I remember at one point I was kind of really lopsided. My feeling, because one side of my face, obviously, like. The one that was really tight was starting to let go, so it felt like it was lopsided, but it probably wasn't. I probably was lopsided before. Do you know what I mean? Like there's been all those kind of things, and like every time I've had something done, it's like there's a whole readjustment, like how to eat. Do you remember at the beginning, I found it really difficult to eat for a while.
Yes, because there was so much more in your mouth of the space even between the
places. That's right. I got the thing with the cheeks, like
where food was collecting. Yes, outside of the teeth, because we've increased the height of the teeth good 2 millimeters, and suddenly more of that space to for the cheeks to push out the food was there, and the whole system had to get used to it. But it eventually did, hasn't it?
Yeah, absolutely, And it's just over a year since we started this journey, and it's been, like, if you'd said to me it's going to be a year, I'd be like, but actually, each doing something and then allowing the body to, kind of like go, oh yeah, that's okay.
Take it time to decompensate, because your posture, everything, it was compensation to the available upper airway volume at the end of the day. The forward head posture, all the tilting.
That? All the time like that.
That was your position, was it? Yes, and you had your head tilted a little bit because you had that pain more on the left TMJ, and I can see that you're kind of more straight now. And it's noticeable for me, and also your therapist, your masseuse mentioned that it's not as tense, isn't it?
You reminded me, like I used to have this. I mean, from doing that all the time, I guess. But this bone here used to really stick out, and it's kind of just. Well, it feels fine now. It doesn't feel like it's really...
Because if you imagine, like, if you lean forward,
and up,
but also forward, it would be more prominent. But if your head reverses back on the spine, it doesn't stick out as much because your head reverses back onto the spine. We lean forward, and if you have to do up as well, that means it's very tight behind the tongue. So it's all about catching air. Breathing. So all the postural changes are adaptation to breathe better. So if we can give more space to breathe, your body doesn't have to do all these things. But it takes time for it to let go and reposition, and that's why it's better to wait and just give it.
You also remind me of like when I had the first one's done here.
Yes.
And how like my face just suddenly went longer.
Yes.
And that was another thing, like, you know, like it was quite like, ooh, when it first happened. But then sort of my face rallied.
Yes, because when we lose height of the teeth, our lower part of face just, you know, shortens, and suddenly we bring 2 millimeters on top of teeth. The whole lower part of the tooth reverses back to that proportion when it's threes from the forehead to the space between the eyebrows, and then that little point under the nose, and then all the way down is the third part, and that should all be in threes. 1/3, 1/3, 1/3. So that was brought back very. Yes, it was.
But I was used to that.
Of course.
So when I had
all these years, yes, and it does make patients look younger when we bring back that proportion.
Oh,
so
yeah, definitely.
Instant.
Like all that, you know, like here, having this volume here as well, I think has really changed like the shape of my mouth a bit.
Yes.
So, yeah, in a good way.
Yes, and the sleep. Can you just tell us a little bit about that? Because that's super.
So sleep. So, you know, bearing in mind I am a menopausal woman, so that, you know, sleep sometimes does elude me. But mostly I sleep quite well. And even if I wake up, I'm not kind of feeling like tired.
So less battling to keep the tongue away from the throat, because that's what patients feel tired, because they're actually making that muscular effort to keep the tongue out of the way and keep breathing, and it's really exhausting because it's our muscles, you know, when patients clench their teeth, it's huge forces. It's remarkable to wear enamel, which is the hardest tissue in the body. If you're clenching, grinding, and you wear your own enamel, these are huge forces, and it derives from the muscles that get tired. You use a lot of potassium, magnesium for all this work. So yes, we are depleted and just also maloxidated. That also gives the sensation of tiredness, you know, that we did not get enough air. Well, that's another conversation, to breathe through the nose. But just wanted to emphasize that what we managed to do is increase the airway volume by moving teeth down and forward a little bit. We did not do any orthodontic treatment when we also go horizontal. So I have explained it to Joe that there might be limitation to the improvement of what we're doing because we are only moving in two directions. That's why that needs to be emphasized, that certainly we will help. We will certainly not make things worse by decompressing the joints and giving more tongue space, but there is a limit to it through the anatomy of the teeth arches. But overall, I think it was worth it, wasn't it?
Definitely. Yeah. I mean, I can't put too fine a point on the fact that I thought I was going to have a hip replacement.
There you go.
I was in so much pain.
And we really did not even talk about that. It just...
Yeah.
It was
it
not
was
an
from
issue.
the snapped tooth, wasn't it?
I mean, but I must say, to me, that was it wasn't on my list as a priority. But of course, that compensation goes all the way down to the feet, and some joints, you know, that pressure accumulates there, and pain.
Just remember something else.
Yes.
Feet.
Yes.
I used to wake up in the morning, because I imagine that all of that going down here and to here, but the feet were also really painful in the morning. Like, I would have to get out of bed and I'd have to move my feet before I could stand on them, because they were
so is it better now?
Yeah, it does nothing.
Amazing.
I just pop out of bed and...
So what that indicates, guys, that spasm in the area where we get the tongue out of the way, it transfers to the whole body. You tense. All the body can tense. It can be individual, but with Joe, it went all the way to the feet. So that must be exhausting. So I'm so happy.
Also, there was a sense of kind of feeling old as well.
Yeah.
You know, all the hips going, now the feet are going, and
yes.
you know, and the thumb was going.
True.
And now I feel kind of like, you know, my body feels great, you know.
Fabulous. Guys, you see, we have that potential to help our patients, so let's do it. Thank you so much. Thank you so much for your patience and all those videos you allow us to film and share it with others. So hopefully there will be more patients who can have such an improvement. Thank you very much. Bless. Bye-bye.